the biggest awareness of healthcare associated infections really started right around the late 90s and early 2000s following an Institute of Medicine report that basically documented that there were a significant number of patients who were both injured and in some cases even died as a result of medical errors, and that one type of cause of this were actually infections that more or less were acquired as part of the patient's treatment in a healthcare facility or a hospital. And obviously this was very concerning, and we've learned a lot more in the last decade about these types of infections, and some of these are infections that are associated with the use of say, an intravenous catheter in the bloodstream. Some of them are associated with methicillin-resistant Staph aureus. Some of them are associated with the use of a catheter into the bladder because people can't get up to go to the restroom. But one that in the last few years has really emerged as a particular problem and has been hard to eradicate is Clostridium difficile infection. And this is a bacteria that basically causes an infection of the intestines, and we ingest it when we encounter the bacteria in the hospital environment or occasionally in the community. But patients in the hospital are most at risk because we get treated with antibiotics and we have weakened immune systems, and then when they encounter the bacteria, the Clostridium difficile bacteria, they end up basically having kind of a perfect storm scenario that all of this together puts them at risk for this infection. And the reality is that after 10 years of working on these healthcare associated infections, when many other types have been declining due to successful interventions, Clostridium difficile has been one of the most obstinate, and it continues to rise. The idea that we've come up with is again recognizing this reality with Clostridium difficile, that not all patients who have the bacteria are necessarily showing symptoms at any one point in time, and it's generally recognized by experts in the field that there can be a sizable group of patients within any hospital or within any healthcare facility who can actually have the bacteria but don't necessarily manifest symptoms, which is usually a diarrheal illness. And so the reality is that you have many patients who can potentially transmit the bacteria to other patients, but we don't necessarily know who those patients are at any one point in time without looking for them. So the concept that we came up with the Gordon and Betty Moore Foundation was to put together a quality improvement project related to C. diff, where we would basically make sure that we were doing all the things already that are known to decrease C. diff rates in terms of appropriate hand washing and hand hygiene, appropriate isolation practices, and certainly isolating patients who are symptomatic with C. diff, but then take really two additional steps that are recognized, one of which is widely accepted to be capable of reducing C. diff, and the other one which is kind of a novel concept. And that's to try and we're introducing an antimicrobial stewardship program, which is well recognized to reduce C. diff rates by basically limiting patients' antibiotic exposure to the patients that really need antibiotics, but not treating patients with antibiotics that really don't have a solid indication for antibiotics, and that puts fewer people at risk for C. diff. But the really novel thing that we're doing with this grant is that we're also trying to go the extra step to identify patients who don't have symptoms but are colonized with Clostridium difficile, either on admission to the hospital or when they get transferred from one unit to another, and to basically test and screen these patients for Clostridium difficile, and then when we identify them, to take extra measures including isolation and hand hygiene measures with those patients to try and limit spread of the bacteria from them to other patients who are at risk for new infection. So one of the things that's unique about this grant and other grants that we've had with the Gordon and Betty Moore Foundation is that they are a unique collaboration between nurses and physicians and other healthcare providers. And so, for example, in this case, the nurses who are obviously involved at the bedside and are really on the front line of taking care of patients, they also have the most contact with patients, and they're also in the best position to assess the patient's risk of Clostridium difficile infection and whether or not they're symptomatic for Clostridium difficile infection at any one point in time. So this grant is actually led by nurses, and then we also participate on a physician level and in the laboratory in supporting them in basically identifying the patients who have Clostridium difficile by performing tests on the samples that are collected, and also helping decide what implementation needs to occur to try and decrease transmission from the patients who are positive for Clostridium difficile in the future.